Hey, I'm Dr. Ganger. Nice to meet you.
Nice to meet you.
What can I do for you today?
Well, I'm coming in because I'm sick.
Okay.
About two and a half days ago, started having a runny nose, headache, cough, and just feeling bad.
Okay.
So I said, I just need to get in because I don't want this to get any worse.
Sure. Anyone around you, like kids or wife, been sick recently?
Yeah, my son has had a runny nose and so forth, and leaving a little bit of fever kind of last week.
Okay.
And my wife's a little bit run down as well.
Seems like it's running through the household, maybe?
Yeah, kind of.
Okay. Does your son go to daycare or anything?
Yes, he does.
Does he? Okay. Yeah, there's always a ton of viruses going around about this time of year. Yourself, have you had any fevers, chills?
No fevers. I haven't really checked, but I don't think really any fevers.
Okay. Any nausea, vomiting, abdominal pain?
No.
Any significant trouble breathing?
No, just don't feel well.
Just don't feel well, okay. And that cough you have, anything coming up with it, or is it pretty dry?
I guess pretty dry right now, but I really just want to kind of get rid of this right now so I don't have to deal with this anymore. That's why I came in.
Okay, gotcha. Any other symptoms in your head, ears, nose, throat, anything like that, other than the congestion you're talking about?
I guess I had some sore throat like the first day, but that went away. But just kind of this cough and stuffiness and just not feeling well.
All right, so it sounds like you have the typical URI symptoms, the cough, the runny nose, a little bit of sore throat. It's been going on for a couple of days. Kids, wife at home may have had this and passed it on to you, and you're trying to come in here and get rid of it before it gets worse.
Right, trying to get rid of it.
Okay. All right. Well, I took a look at your vitals. They're all stable. I'm not concerned from that standpoint. I'm going to do a quick exam here, and then we can kind of talk about some plans.
Okay.
All right. Anything else going on that we didn't talk about?
No, I was just hoping I can, get an antibiotic and get back to, square one.
Okay. All right. So I'll tell you kind of my general education on what we call an upper respiratory infection.
Okay.
So most of these are caused by viruses, though sometimes you can get a bacterial infection. Really the way we tell as doctors, since we don't have a magic ball to know for sure, is severity of symptoms. So things that are kind of red flags are really high fevers that don't go away, stuff coming up with your cough that would indicate maybe a pneumonia or an infection in your lungs, and then a lot of times just length of symptoms. Your body is well equipped to take care of viruses, but it takes your body some time to get the antibodies up to deal with it, and so the general course is anywhere from 5, 7, 8 days long. So usually if you come to me with these symptoms and it's been 2 days and you're not having really high fevers or productive cough or any other things that we call red flag symptoms, I'll tell you that it's most likely a virus, which in your case I think it is. The treatment for that is give your body time to heal and don't put any increased stress on your body. So you want to take it easy, take a few days off work, relax, don't do anything strenuous, plenty of fluids, water's good, orange juice, Gatorade, anything really, and just let your body have time to heal. You can get sleep extra if you need to. If you're having symptoms like discomfort in your throat, maybe some minor fevers, you can always take Tylenol, Motrin. There's a lot of over-the-counter products that combine a decongestant with a medicine to get rid of your fever and for cough. So you can look at the Alka-Seltzer products or the NyQuil or Dayquil.
Okay. I guess I was kind of hoping that you'd give me an antibiotic. What if I told you that I guess this morning something did come up, like a little bit of yellow when I coughed? So does that mean I can get an antibiotic? It
probably wouldn't really change my recommendation for you. If you cough enough, you'll irritate the lining of your throat, and you'll get a little mucus because it's protective. And a lot of people think antibiotics are helpful. I'll tell you two things. One, it won't treat a virus at all. They only treat bacteria. So if I give it to you, it won't help you. And in fact, it can harm you because we all have bacteria in our bodies. If we give you just a little bit of antibiotic for a short course, the bacteria can see that and become resistant to that. So that when you really do get an infection and we try to give you these things, they won't work. And then that can lead to serious problems, including getting admitted to the hospital. So
I don't want that.
Right. So I really, what I would say is, why don't we let it go to the end of the week, and that'll be about 6 days duration. And if you're not getting better or you're getting worse at any time, give me a call and we can send you something in without having to see you again.
Oh, That's reasonable.
Okay.
I appreciate you.